Hi, Dr. Michelle Savu here from Beijing, China. It's March 16th, 2020. Most common question I get asked about is this, the mask. Don't touch it. So, yes, here in China, we are all mandated to wear a mask when we're outside. There are pluses and minuses to wearing masks. One is if someone sneezes or coughs, they cough into the mask and decrease the spreading of respiratory droplets. If they're infected, that's one way they can spread the infection. The second advantage of the mask is it may keep you from touching your nose and mouth. The studies show that we touch our nose and mouth or our face 27 times an hour. So if this keeps you from touching your mouth and nose, that's helping you. However, as soon as you go under the mask to touch your mouth or nose, you completely negated the fact that you have a mask on, and that's why they're telling you not to wear it. So what happens if you don't have a mask? Well, in the United States right now, today they're expecting the peak to be somewhere in late May or June, maybe up to July. And so right now, it's not that dangerous for people in the United States because you're not having such high amounts of people in the community with the disease, so they're not spreading. So you practice social distancing, which means stay 6 feet away from anyone while you're waiting in lines, and when you go to the supermarket, etc. Don't go to crowded places, stay inside, eat inside, don't go to restaurants. That will decrease your risk. And it's been said, I'm sure a million times, that washing your hands is the #1 prevention. So if you don't have a mask, that's okay. It's not mandatory. Not every country, I believe Singapore is not recommending wearing of masks. I do believe by June the production of the masks will be up, but of course they're going to give the first ones out to the medical personnel. There have been randomized studies that show whether you're wearing a respiratory mask, the very tight-fitting ones, or the surgical mask, the one I'm wearing now, that if the medical professional does that while they're seeing someone with the normal flu, they still have an 8% chance of getting infected. So no matter how you're wearing a mask, it's not 100% effective. I would say it just gives you an added layer of protection, but it is not mandatory. It's the hand washing that's the key. Soap and water, #1. If you don't have that, these hand sanitizer, if you don't have that 70% alcohol, ethanol, something like this. Okay, so again, no panic needed. I'm outside on a beautiful day, and you can actually see spring will come. It's coming here in China, and there are the early cherry blossoms. It'll come in the United States too. It's just going to be a little different this year. So stay calm.